most of the people, all 500 applicants, 520 actually, they were all American students who graduated. Here's why I say this, because they're burning out, right? So what did all those 520 people do? Reached out to me to get a pay cut from 450, 350, 252, less than, roughly 80 to 100,000 for coaching positions.
Once you get an MD, what can you do with it other than practice medicine? Again, I mean, because for a lot of our students, it's like, my only alternative is to become a hospitalist. But that isn't true, obviously, as you're like a shining example of that.
I realized through my rotations and my studies, not only did I love prepping and teaching, but I realized that there was more for me than just being in a hospital. So what I did was, from being in medicine, I realized I had more of a passion to work with students and physicians to crack the code and help them pass the board exams. I do not want to continue medicine. So if you have an MD, well, yeah, you can be a consultant. If you're licensed, you can move on to consulting different companies, pharmaceutical companies, versus you finished MD, and then you say, well, you can then venture into certain specialties that can use your knowledge, right? People can use that knowledge for their advantage and yours in majority of specialties out there in business.
And they called me up, the CFO called me up, and he's like, I really want to have MDs come for this program. And I was like, wait, but they're MDs. Like, why would they go into finance? And he's like, well, I'll have you know that. Then the CFO was like, I'm an MD or MBBS from India, Stavros. But he said that he feels the most successful financial professionals within a hospital system are MDs, because they understand. So this particular training program, it starts off with like a resident salary, but within about 2 years, you become a full-blown financial associate, and then you're kind of on a track for a CFO position.
There's a lot of companies that, for example, short-term disability, long-term disability, insurance companies, instead of having someone who has no knowledge of medicine, they say, well, we'll hire nurses and or MDs to consult and be like the head of the department to say, well, you see, MDs are needed everywhere. It's just up to the individual. Do you want to practice medicine? Or, hey, I'm just tired. I'm burnt out. Husband, my kids. And unfortunately, in the system, even though it's a beautiful system, you work in many hours and it's not for everyone. Instead, I said, I don't want to be stuck in the hospital 80-hour weeks, writing notes, seeing patients, being exhausted.